Hello, my name is Nadine Fletcher, and today I will be presenting my grant proposal titled Chronic Pseudomonas aeruginosa Infections and Lung Function Decline in Adolescents with Cystic Fibrosis. Cystic fibrosis, or CF, is a genetic disease caused by mutations in the CFTR genes. These mutations disrupt the movement of chloride across epithelial cells, which leads to thick, sticky mucus buildup in the lungs. This thick mucus creates an environment where bacteria can grow and persist. One of the most clinically significant pathogens in CF is Pseudomonas aeruginosa. This bacteria is especially difficult to eliminate because it forms biofilms. Biofilms act like a protective barrier that allows the bacteria to resist antibiotics and avoid clearance by immune system. The central idea of my study is that repeated Pseudomonas aeruginosa infections may accelerate lung function decline in adolescents with cystic fibrosis. Even though fewer therapies such as CFTR modulators have improved survival and baseline lung function, chronic infection remains a major contributor to long-term lung damage. The purpose of this study is to determine whether increased infection frequency is associated with faster decline in lung function measured by FEV1 in adolescents with cystic fibrosis. To understand this relationship, it is very important to examine how lung function is measured. In CF, lung function is commonly assessed using spirometry, specifically a measurement called forced expiratory volume in 1 second, or FEV1. Spirometry has been used in respiratory medicine since in the late 19th century and became widely standardized in the 20th century. Today, it is considered the gold standard for evaluating lung function because it provides consistent and reliable measurements of airflow limitation. FEV1 measures how much air a person can forcefully exhale in 1 second. Lower FEV1 values indicate greater airway obstruction and more advanced disease progression. Spirometry has also been used extensively in large-scale cystic fibrosis registry studies where it has consistently been shown to be a reliable predictor of disease progression and survival. Because of this long history of validation, it is widely accepted in both clinical and research settings. Research published in journals such as the Lancet and Journal of Cystic Fibrosis demonstrates that infection with Pseudomonas aeruginosa is strongly associated with declining lung function. However, findings in the literature are not entirely consistent. Some studies suggested that CFTR modulator therapies reduce infection severity, while others show that chronic infections continue to persist despite treatment. This creates an important gap in knowledge because the effect of repeated infections over time has not been fully explored, especially in adolescence. Adolescence is a critical developmental stage because lung function may decline rapidly during this period. Identifying risk factor early may help improve long-term clinical outcomes. This study addresses the gap by focusing specifically on infection frequency as a measurable predictor of disease progression. Now I will move into the methods section. This study uses a retrospective cohort design, meaning it analyzes existing clinical data collected over time rather than conducting a new experimental study. The sample population will include 75 adolescent patients between the ages of 12 and 18 years old with 3 to 5 years of longitudinal clinical data for each patient. The data will obtain from a cystic fibrosis clinical registry using de-identified patient records. This study examines the relationship between infection frequency and lung function decline using two primary measurements. First, lung function measurement. Patients undergo spirometry testing during routine clinical visits. During this procedure, the patient takes a deep breath, then exhales forcefully into a spirometer. The spirometer records FEV1, which reflects how efficiently the lungs are functioning. FEV1 is expressed as a percentage of predicted values based on factors such as age, height, and sex. The second infection measurement, pseudomonas aeruginosa infections, will be identified using sputum culture results, physicians' confirmed diagnosis. The number of infections each patient experiences will be recorded annually. The independent variable in this study is the annual frequency of pseudomonas aeruginosa infections. The dependent variable in this annual rate of decline in FEV1. To analyze the data, linear regression will be used to determine whether infection frequency is associated with lung function decline. Multivariable regression analysis will also be performed to control for possible confounding factors like age, sex, CFTR modulator therapy. Statistical significance will be defined as a p-value less than 0.05. In addition, it is important to understand how repeated infections may biologically contribute to lung function decline. Chronic Pseudomonas aeruginosa infection can trigger persistent inflammation in the lung. Over time, this inflammation damages airway tissue, reduces elasticity, and contributes to progressive airway obstruction. By measuring infection frequency alongside changes in EFV1, this study evaluates not only whether infection is present, but also how repeated exposure over time may influence the rare rate of lung deterioration. This method is effective because it uses validated clinical measurements and real-world longitudinal data, allowing disease progression to be studied naturally without introducing experimental risks. Next, I will briefly discuss the budget for this study. The total estimated budget is $2,500. Data access will cost $500. Statistical software will cost $200. Research assistance will cost $1,500. And miscellaneous expenses, total of $300. This study is relatively cost efficient because it relies on existing clinical data rather than requiring expensive lab experiments or new patient recruitment. In conclusion, this study examines whether repeated Pseudomonas aeruginosa infections contribute to faster lung function decline in adolescents with cystic fibrosis. By focusing on infection frequencies rather than simple infection presence, this research provides a more detailed understanding of how chronic infection may influence disease progression over time. If a strong association is identified, infection frequency could serve as a practical clinical marker for identifying patients at high risk for rapid lung decline. This could allow healthcare providers to 1. Identify high-risk patients earlier, 2. improve monitoring strategies. 3, adjust treatment plans more proactively. And 4, to potentially reduce long-term complications through earlier intervention. In addition, the findings from this study may contribute to future research focused on improving infection management strategies in cystic fibrosis care. Overall, this research has the potential to improve both clinical decision making and long term outcomes for adolescents living with cystic fibrosis. Thank you so much.